The humanitarian crisis in Gaza is spiraling out of control. Despite ceasefire agreements and international appeals, aid remains blocked, access remains restricted, and millions are teetering on the edge of starvation, disease, and collapse. It was during a fragile ceasefire that the Norwegian Refugee Council and other aid organizations managed to scale up life-saving interventions. Clean water was delivered to over 130,000 people. Tents and shelter provisions reached more than 13,500 displaced families. Hygiene kits, medical supplies, and emergency cash assistance allowed thousands to recover some dignity. But that brief window of relief has now closed, and the blockade has returned with full force. Since early March, Israel has imposed a total blockade of humanitarian aid into Gaza. All goods, food, medicine, fuel, shelter supplies, have been prevented from entering. Supply lines are cut, crossings closed or heavily restricted. Even those goods that are inside Gaza often cannot move internally, either because of damage to infrastructure, bombardment, or armed conflict along the routes. And thousands of trucks queued at border crossings have turned back, or wait under conditions where aid spoils before it even reaches people in need. The impact is catastrophic. 2 million civilians depend almost entirely on humanitarian assistance. Clean water supplies are dwindling. Desalination plants can no longer operate reliably because of fuel shortages and power cuts. Hospitals, already severely damaged, are running on backup generators that fail frequently. Many medical facilities simply lack essential supplies. For many wounded or sick, there's no access to surgery, no antibiotics, no safe childbirth. Children are among the hardest hit. Malnutrition rates are surging. Families report going without sufficient food. 1 meal per day has become a luxury for many. Rates of severe acute malnutrition for children under 5 are rising. If aid does not resume at scale, famine is a looming threat. Waterborne diseases spread quickly when sanitation systems are down and drinking water is contaminated or scarce. Very little shelter is available. Over half the housing in many areas has been destroyed or badly damaged. Displaced families sleep in makeshift camps, public buildings, or even open spaces. When rains come, flooding brings new risks. Cold nights, no fuel, no warm clothes. All of these turn into matters of life or death when people are exposed and vulnerable. International law is clear in armed conflict. Civilians must have access to humanitarian relief without undue delays. Aid must be facilitated, not obstructed. The NRC has repeatedly called on all parties to uphold their obligations. But in Gaza, obstruction is not just incidental. It appears systematic. Negotiations over ceasefire terms continually stall when aid access is referenced. So deeply has the stalemate become embedded in political calculation that aid becomes a bargaining chip. The ceasefire delays are exacerbating everything. Though agreements have been reached in principle, their implementation has been faltering. Each delay in renewing or enforcing the ceasefire means another day without aid. Another day of suffering for hospitals, children, the chronically ill. Every breakdown in ceasefire talks leads to a surge in violence and a shutdown of supply routes. Meanwhile, aid agencies are stretched to breaking point. Staff are overworked, resources exhausted, and many who used to operate in Gaza have had to pull back due to safety concerns. Some warehouses are empty. Many organizations warn that if conditions worsen further, they will have no choice but to scale back operations or leave altogether, leaving Gaza's population with even fewer lifelines. On the diplomatic front, international condemnation is increasing. UN officials, humanitarian NGOs, and governments around the world are demanding that Israel lift the blockade and ensure safe, sustained humanitarian access. Critics say that if aid remains blocked and ceasefire remains delayed, the situation will cross thresholds of man-made disaster, possibly qualifying under international law as collective punishment or use of starvation as a method of warfare. But there are glimmers of hope. A few crossings have been reopened on a limited basis. Some fuel has trickled in. Some aid convoys have managed to reach isolated communities. But these small reliefs are far from enough. The scale of need has overwhelmed them. To reverse the slide into deeper catastrophe, What is needed now is not just pauses or partial access. It is a full, sustained corridor of aid, predictable access, protection for aid workers, and real commitment from all parties to ceasefire conditions. For the people living amid this worsening nightmare, the choices are shrinking. Go without food, water, medicine, or risk traveling dangerous roads to try and get help. Pay high prices for basic items that are available locally. Risk disease, risk death. In many households, women are walking long distances to fetch water. Parents are skipping meals to feed their children. Hospitals are choosing which patients to treat, which to send away. The clock is ticking. Without dramatic action, reports caution that Gaza could face a humanitarian breakdown of irreversible proportions, mass famine, collapse of health systems, epidemics, death by preventable causes, especially among the most vulnerable children, the elderly, the disabled. The moral question is also political. Can any ceasefire be considered meaningful if aid is not flowing, if crossings remain blocked, if civilians are dying not just from bombs but from lack of essentials? This is the test for the ceasefire negotiators. As of now, the crisis deepens. Aid remains blocked. Ceasefire delayed. Lives are slipping away. For Gaza's suffering to be stemmed, the world must see more than words. It must summon action, access, and urgency.